Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. I am Hasimah Binti Chik from University Malaya. We will discuss about the holistic care based on Islamic Psychospirituality towards resiliency of palliative patients. The outline for my presentation is introduction, problem statement, objective, methodology, result discussion, conclusion, and suggestion. First of all, we look for palliative care definition, which is the active holistic care of individuals across all age with serious health-related suffering due to severe illness and especially of those near the end of life. It's aimed to improve the quality of life of patients, their families, and the caregivers, whether physically, psychologically, socially, and spiritually based on WHO. And in this study, we emphasize the element of spirituality because based on previous study, it has been proven that the element of spirituality can help the individual to have a better quality of life. In order to improve spirituality, to improve the quality of life, we are using Islamic Psychospirituality approach. And before we go far, we look first for the definition of Islamic Psychospiritual, which is thought or study that integrates psychological, spiritual element about the mental process and spiritual thought from the perspective of Islam. Islamic psychospiritual can be understood as a concept and treatment method for soul disorder, nafs, ruh, qalb, mental, emotional, moral behavior refer to the source and practice in Islamic base on Quran, Sunnah and practice of Ahli Sunnah wal Jama'ah scholar and knowledge that does not conflict with the principle of Islamic Sharia, which aim the happiness in this world and the hereafter. I can emphasize here, Islamic psychospirituality is treatment method for soul disorder, mental, emotional, moral behavior that we can emphasize. We are using Quran, As-Sunnah and Ahli Sunnah wal Jama'ah scholar. There is not conflict, nor conflict with Islamic Sharia. Based on literature study, we can see that Islamic psychospirituality and healthcare telah banyak dilakukan. It's already abundant, which is first we can see Islamic psychospiritual approach through prayer and hope therapy can make patient better, which is they feel healthier, they feel more positive. And second literature, divine therapy approach. Divine therapy approach is therapy ilahi that we emphasize on Allah is the great, Allah is the most merciful in the therapy. And second is repentance therapy. Reading the Quran also can treat anxiety and depression. The third one is the emphasis of Islamic principle on increasing meaning and purpose in patients individually can give great impact in patients' life. Okay. Based on what we discussed before on literature study, there is a positive impact on spiritual and psychospiritual emphasizing in treatment. But in the problem statement shows 72% of terminal patients were found to experience depression during treatment. What happened? Because mental and spiritual distress are related to each other because they involve in individual inner issue. Depression is one of disorders that will occur if individual experience spiritual anxiety. Second is 80% of medical practitioners never orally discuss aspects of spirituality when with patient. This is maybe because due to lack of knowledge, skill, and also maybe medical practitioner or healthcare providers lack of time to focus on spiritual issue because they have a lot of patients to focus on. So we need somebody or someone that focus on spiritual issue with patient, such as spiritual care providers and others. And the study objective is to study healthcare needs on patient. And second, analyze Islamic psychospiritual knowledge toward resiliency of palliative patients. The methodology that I use in this research is questionnaire, 7 Likert scale, 254 respondents from hospital university, and the sample using is a patient and carer themselves because we want to know about their perception on healthcare needs, and we analyze using SPSS. The results show spiritual needs uh, the highest, which is 6.34 mean, and followed by emotional and mental needs. Based on the result, I want to focus on spiritual needs. What is the content in spiritual needs? Which is first, meaning of life, having hope, belief in God, forgiveness from God, forgiveness from others, religious practice, which is include praying and fasting during illness. And the most highest rating from the respondent is having hope, which is in spiritual need, they need hope. It's higher than others. And the results show all high. Semua tinggi. Result show 6.0 and above. All the items of spiritual needs in healthcare. While the second highest is mental need. Shown items include coping with anxiety, stress and depression, decision making, gain knowledge and information, self-managing relapses, worsening of medical condition. And the highest item is gain knowledge and information, where we can see patient and caregivers need to know anything happen, the condition and the situation that happen and do for them is in their mind. So everything, doctors, healthcare providers, spiritual care providers need to tell them what happened to themselves, to the patient, what happened. Because if they know everything they know, it's a release for them. Third element in healthcare need is emotional need, which is include cope with traumatic event, deal with different emotional expression, looking with enjoyment at peace, and get sudden feeling of panic. And the higher element or item is looking with enjoyment at things, which is patient dia facing struggle. They are facing struggle in treatment. So what they need is they want the therapy. They want to be helped in looking with enjoyment at things. So what they vote, what they give their rate in this research, if looking with enjoyment, so we need to help them in this item. Based on what we discussed before, the needs in care, the needs in health care is to cover the spiritual need, emotional need, and mental need. And the Islamic psychospiritual element or suggested therapy that we can use to improve resiliency of palliative patient. First of all is uh, the first sentence in the Quran, Bismillahirrahmanirrahim. Allah is the most gracious, the most merciful. We can see the most merciful of Allah, Ar-Rahim, has been shown through Muhammad sallallahu alaihi wasallam. From the hadith, we can see a Muslim has 6 duties toward other Muslim. When you meet him, you should salute him. When he invite you, accept his invitation. When he asks for your advice, give it to him. When he sneezes and praise Allah, say, may Allah have merciful on you. When he ill, visit him. When he is ill, visit him. When he dies, follow his funeral. Narrated by Muslim. And in medical term, we use compassionate presence. We can see from the paper from Puchalski, compassionate care can involve empathy, forming connection, helping patient with issue, being respectful, being caring, present, call upon a unique set of skill which the clinician moves a more reflective and contemplative space with patient. We can see in the hadith already shown about this this style, this skill of care, and how Allah know us better from the others. What we discussed before is the most important approach. It's the basic approach before we go to the next step. And this is a second suggested therapy that we can use to improve resiliency of palliative patient, which involve a few steps. First is muhasabah an-nafs, which is self-reflection, and second ma'rifat an-nafs in pre-session of the session, and second phase is intervention, which include mujahadah an-nafs, self-struggle, and riyadah an-nafs, self-training to achieve our goal, which is as-sa'adah, happiness. This therapy based on client-centered and need a repetition process until we achieve the goal. Here we go one by one. Pre-session therapy, muhasabah an-nafs, self-reflection, and ma'rifatu an-nafs, self-realization. In muhasabah and ma'rifatu an-nafs include two types of therapy with rajah, hope therapy and forgiveness therapy. In hope therapy, put hope in God and there is blessing in every struggle. Patient need to know. We need to tell the patient that there is a blessing in every their struggle, and there is still hope for them to live happily. And forgiveness therapy is Allah always forgive His servant, and everybody have their right to being forgive and ask for apologize. After we settle on pre-session therapy, we go for intervention therapy, included mujahadah an-nafs and riyadah an-nafs. Both therapy, pre-session and intervention therapy, is a repetition process until we achieve our goal is as-sa'adah. And in mujahadah and riyadah an-nafs included Quranic therapy, qiyamul therapy, ablution therapy, charity therapy, zikir and praying therapy. Quranic therapy will give peace in our heart by hearing and by reciting, because Allah already said in the Quran, in surah Ar-Ra'du, verse 28, siapa yang ingat Allah akan menjadi tenang. Okay, for qiyamul therapy, grow the resilience of the soul by closer to God, which approved by Prof Haji Amin Syukur, which is one of cancer survivor. He used qiyamul therapy to grow the resiliency and during facing the struggle. Qiyamul therapy also practice acceptance and patience by closer to God. And the third one is ablution therapy, maintain cleanliness of body part, activate the nerve of ablution organ, and maintain positivity. When we take wudu, we touch every single thing in our body and will trigger positivity for us. And fourth is charity therapy. Charity therapy will make a practicing gratitude in our life, because Allah gives us so many things in life and we should have our gratitude and practicing patience with test from God. While the last one is zikir and praying therapy. There is a lot of zikir that we can use in everyday life. One of example I can say here, Astaghfirullah innallaha kana ghaffara. Hasbunallah wa ni'mal wakil. We say it every time and we repeat, we'll grow our resiliency in our heart. And I can conclude the study is about treatment of disease based on the book of previous scholar, the study of contemporary Islamic scholar, and also Western scholar. Holistic health element are physical, spiritual, mental, and social. The focus of this study is to provide spiritual emphasis in therapy. For further question, you can contact me through this email and number phone. Thank you. Assalamualaikum warahmatullahi wabarakatuh.